happy to have our guest, Valerie Creedon. She is a local licensed clinical social worker, and she is actually looking to talk to us about something that's very important. We know that July is American Diabetes and National Minority Health Awareness Month, but that all rolls into things that we need to have for care for our veterans. And who better to talk about that than Valerie McCreedon? She actually is going to be talking to us about the post 9/11 military to VA program and what it means, what are the components of it, and why is it so important for our veterans to know this and to be able to, respond to it appropriately and use the services. They're there for you. And she is one of those dedicated people that sits there and waits for you to come in. So we want to
It's
make
true.
sure you know that people are sitting there waiting for you to come in. So welcome, Valerie. You can tell us a little bit about this program and how this programming partner, Jesse Brown, VA, M2 VA program and services works. Okay.
Sure. Thanks for having me, Dr. Arnold. We are now called the Post 9/11 Military to VA program. In the past, we've gone by other names. Some people are familiar with us as the OEF, OIF, OND program. Sometimes they've heard about us as TCM or Transition Care Management, Post Deployment, Combat Care Management. We're the same program. We're just trying to get to that name that really reaches out to people and clarifies a little bit what we do and who we're doing it with and who we want to reach and get them engaged in services. So we work with the returning combat veterans, and we also work with folks coming from military treatment facilities. There are transfers that come sometimes directly from there to us. So folks may still be on active duty for a little while, which is okay. We're able to work with them as well. We can assist family members as well to some degree if it relates to veterans care. And we also now work with, which is a little bit of additional than we have historically in the past, but we work with anyone that has separated after 9/11, post 9/11 veterans that are transitioning from the military to the VA. So if you've never come to the VA since you've been separated from the military, we're looking to reach out to you as well, whether or not you had combat. We want to make that transition easy, and we want to make it look good and like something that you'd want to do, help you cut through any barriers, understand the systems, learn about the different resources and benefits that you have available to you, help you understand the language of the VA, which can be very different than the DoD or a regular hospital setting or a civilian setting. We want to make sure that you know that there's unique services available for you, that many people, once they've taken advantage of the services, I've heard them say, oh, geez, I wish I knew about those earlier. I mean, we have things like recreation therapy that we work directly with in our program. We have a liaison with the recreation therapy program that comes to our meetings on a regular basis so that we can connect our veterans to recreation therapy, for example. Not everybody knows that that's a service that's available. We connect people with mental health services, with primary care services, audiology, orthopedics, whatever it may be. And sometimes we can help coordinate appointments if you're coming from a long distance and maybe you have 3 different appointments and you'd rather come on one day versus 3 days in a row, making that long drive in the city of Chicago traffic. We can help with that. We can answer questions about letters that you get in the mail from the VA. We can help coordinate appointments in the community to some degree if you're having trouble figuring that all out, like resources for figuring out your post 9/11 or your GI Bill to utilize for college. There's all sorts of things we do nowadays. And another thing that's happened since March 5th of 2024, the president enacted the PACT Act into law, and that expanded VA healthcare and benefits for veterans exposed to burn pits, Agent Orange, and other toxic substances. So that's a lot of our veterans too that maybe in the past weren't eligible or didn't think they were eligible for services or care. This has changed that dramatically. It's opened up the availability for healthcare for many of those veterans, and we are trying to help the VA nationwide spread the word and tell people about it so they can come in, register again, check out their eligibility, see what has changed, and if they're eligible now. For example, for our combat veterans, they extended that enhanced combat eligibility period from the 5 years it's been to 10 years now. So if it has been 10 years, if it's within 10 years of your separation from the military, not from when you came back from combat, but from when you separated from the military, and you were in combat, you have an enhanced combat eligibility period, which means your income and other things are not taken into consideration at that point. You are eligible for VA healthcare. So we really encourage everybody to take advantage of that, get registered and enrolled. Once you're registered and enrolled, that's not going to change. You may at some point have a copay. You wouldn't during that 10 years. The copays are currently $15 for a regular appointment and $50 for a specialty appointment, but there's not standard monthly fees like there are that most people think of when they've got health insurance. So registering for the VA doesn't mean that you're automatically signed up for those regular traditional healthcare plans where you're paying a monthly fee for your health insurance. This is a benefit that you've earned. It's not an insurance. It's a benefit, and we want everyone to take advantage of it. And we certainly want anyone that's been in combat to take advantage of that enhanced eligibility while they can.
Yeah. So how does this affect the family members too? Because I know a lot of family members are worried about their service members and how they are, actually receiving services. And I know you probably have some interactions with family members. And how does that go? How does that sort of play out?
Sure. So we do have family therapy available in terms of couples therapy at Jesse Brown and at our at some other satellite sites. So that's an option. We also work in conjunction with veterans. We're not necessarily, unless we have permission from the veteran, we can't give out details of the veteran's care to family members. But if family members want to give us a call and tell us some concerns or information that they would like to have addressed at the VA with their veteran, we can certainly listen to those, and then we can ask the veteran for permission. More often than not, they give it to us, and we're able to work together to treatment plan, come up with plans that work towards everyone's goals, right? Because sometimes our heroes are just that, and they're not always willing to talk about some of the things that need to be brought up in order for us to work on things. So family members can be crucial in providing information and helping us help veterans. We have things in place also like caregiver support program, which is beneficial for family members. They can be you can talk to your primary care provider, and if you're eligible, if the veteran is eligible, then a caregiver can be assigned, and that can be a family member, and then they potentially could even be eligible for health care. They are eligible for services and support services through the VA and through our caregiver support program. There's also something called CHAMP VA that service-connected veterans are eligible to apply for their family members, where they would be eligible for VA healthcare as well.
What about the regular services at Jesse Brown VA? How does this impact their services that they normally see a provider, a primary care clinician or specialist? And do you, help, coordinate that kind of care too, especially with those people who are already, in the system?
Sure, absolutely we do. We work directly with VA liaisons at military treatment facilities for those that are coming to us directly from a military treatment facility. And most often, we will know what appointments they need ahead of time, and we can get those set up before they've even arrived back home. So, if whether it's a specialty appointment or a primary care appointment or both, we can get all of that set up before they even come home. For those folks that are already home and that are registered and enrolled and working towards meeting whatever medical or mental health goals they're working towards, we can work with them to kind of, depending where they're at and what they need. If they need reminders and help with setting up and coordinating appointments, we can help with that. We have we have a lot of younger veterans in our program that are school aged, which I guess these days is everyone, right? We can all go back to school if we want. But if you're going back to school, for example, our health tech has been instrumental in our program and assisting veterans with getting all that kind of paperwork that needs to be filled out ahead of time by primary care docs. Their physicals for school or immunization records, things like that. Our health tech is able to coordinate and get that paperwork completed without having to come in necessarily for an appointment just for that. And then, like I said a little bit earlier, if you have multiple appointments, we can help coordinate those to try and get them on the same day, or we can also help coordinate to get them on a day when you're not in class, or where you're not working, or a day that you will have childcare, so that it meets your schedule. And we can occasionally get a walk-in accommodated as well to make sure that our veterans are seen.
Oh, great, great.
Yeah.
So it sounds like you're doing a lot of things to coordinate care, to keep the family functioning, because it can be really disturbing,
Sure.
when people don't know, first of all, how to navigate the system, and then they have family members, especially if the person who is being treated has some severe, medical issues,
Hmm.
especially with PTSD or
Right.
some cognitive decline or some really advanced stages of disease such as cancer or kidney disease.
Right.
So having that support service is really critical. I'm sure it takes a lot of the burden off of the family members as well. You know, but then the children are also involved in this story too, and I'm not sure of how that sort of plays into everything, because the children also have to be part of this healthcare network team, and I'm not sure if if those services are extended to the entire family or just to the basically the spouses.
Yeah, so unfortunately, the VA is not really set up for childcare. We don't have all the necessary tools, equipment, things that smaller people need. So, and we're not legally allowed to provide that care. Um, but what we do provide is referrals and resources for that information, um, and into the community and local facilities that the veterans can utilize with their family members, their children, their loved ones, and access care that way for them.
And then also what so how is this funded? This is funded through, I guess, the Department of Defense, or the funding for this comes through the hospital system, and I'm not sure of how that's allocated, and whether there's any legislation that's going on that's important to be aware of, to make sure that we're supporting that kind of initiative.
For children and families, or in general for the services we're providing?
For making sure that this program is supported, because it seems like it's essential that we, need to be aware of it and taking advantage of it. And you have people who are post 9/11, military families, people coming back from overseas. So you're taking care of people, not just people who are veterans who have, retired or, left service, but people who are actually engaged, who are actively in the military as well as they're engaging with the VA. So if they come back from, overseas and all that, any special things that we should be aware of as far as care concerns, or things that we should be doing as veterans to let people know that this is value to us, because everything comes back to dollars, funding, 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 and how can we play a role in that?
So for for the active duty folks that we're working with, um, they're wrapped into the transitional care, the case management that we're providing. The VA has a handbook 1010 that states we have to provide this care, that we have to have a program. So each VA in the nation has a post 9/11 military to VA program that's available for these returning combat veterans and active duty service members to utilize. So anyone at any VA can walk in and ask to speak to the program manager, and that person should be available to them. In terms of receiving care and funding for that, if they are still on active duty and require care before they separate, then we would work with the VA liaisons that are at each military treatment facility to secure TRICARE authorizations that would cover that care for the service members. That would be where that funding comes from. And then for those that have returned home, part of the funding, at this point during the first 10 years would come from the PACT Act, because there's no copay for anything that is related to combat during those 10 years. And then after that time, there is a possibility of a veteran being service connected that would fund that would take it wouldn't fund, but it would take away their co-pays. So they wouldn't have a copay if they're service connected. If they are, there's a small copay that could potentially be assessed. And that funding comes from Congress through the Department of Veteran Affairs, um, and our budget every year.
Very
So
good.
yeah.
What, yeah, because my mother was a social worker for she was from the age of 21 to 91. She was actually still seeing people and talking to them, and so what's your wish list? What do you think needs to be done to make things better? Are there things that you think we need to be looking at, or just our interaction with the system in a better way? But what are some of the things that you hope to see as this progresses over time?
In my heart of hearts, that they continue this program, now that it's expanded to beyond combat into transitioning veterans. I really hope that this value added is seen by the community at large and Congress and everyone else out there that needs to see it, because the goal is really to get people in and get them the help and care they need. I feel like sometimes those folks that I run into in the community that haven't been in to see us yet have been suffering needlessly when we can provide care and assistance to them. And I've had recently our program has moved locations, and during that time I've had several veterans who have been working with the post 9/11 military to VA program come in and tell me stories about how once they found out about the VA and once they utilized the services, how to quote one of them, it made me who I am. Another veteran told me it saved my life. um, so I want people to realize how important the VA is, and those posters and ads that you hear about the unseen wounds of war and of military, it's real. It's a thing. It needs to be addressed, and we need to support the folks that need to access this care, and we need to make it available and keep it available for them.
Service members are also homeless, and we still have a problem with that, and veteran suicide and all of that. So how does that play a role in this system?
So that's another great hope, wish, or dream of mine that I hope keeps getting funded and recognized and seen in the community. We have a very robust homeless program. We have an expanding suicide prevention team at Jesse Brown and within the VA in general. But it's those folks that probably need us the most and maybe aren't willing to ask that question just yet. So they need the most support so that they can come in and actually take advantages of those services that we provide. And we need to be able to continue to provide those services. So we need to count on that staffing, those resources, and the funds that'll be available for those programs to keep going, and so that we can help all of those folks that reach out through the suicide prevention hotline number. We can help the folks that someone else calls us about because they're concerned about them, folks that self-identify as being at risk, the homeless folks that have truly served our country and deserve the best care we can give them. We need to be able to provide that for them. And we have folks on those teams that truly care and are really doing their best to reach out to everyone and make that happen.
Oh, great, great. Yeah, because we're running low on time, of course. There's always never enough time to talk about things like this. Um, and give me your pitch. I'm a veteran. Why should I contact the service? How can I contact the service? How can I get engaged with the services? Of the post 9/11 military to VA program. And what should I be looking for or thinking about when I enter a VA hospital or a healthcare facility?
So I would love for you to remember that the people around you are veterans as well. They had to take that first step too. Please continue to take that step. And if you run into any problems or hassles, ask for the military to VA program. We are there to help and support you. At Jesse Brown, we're able to, if you walk in, we will see you. If you would like to schedule an appointment because that works better, we will do that. You can call 312-569-5900. That's 312-569-5900. And that's our general line. And you'll be able to set an appointment or ask a question.